Urgent notice. 8 frequently overlooked olfactory indicators of cancer. Ever wonder if your body's trying to give you a heads up? What if that heads up came as a smell? Crazy, right? Turns out, your body odor might actually be warning you about something serious, like cancer. Most people miss these subtle signs, but we're here to spill the beans on 8 cancer smells you might be overlooking. These could be lifesavers, for you or someone you care about. Stick with us. This info could mean the difference between early detection and a missed chance to take action. 1. Sweet breath odor. Sweet or fruity breath, like fermented fruit. It's not your typical bad breath. This lingers, even after brushing and flossing. Why cancer cells in the lungs can change your body's chemistry, creating and trapping volatile organic compounds, VOCs, that cause this unique smell. It's easy to miss because the sweet scent might seem like a digestive issue, or even diabetes, not cancer. Plus, early lung cancer often has few obvious symptoms, so this smell can easily be overlooked. It's often confused with common problems like bad dental hygiene, acid reflux, or complications from diabetes. But don't worry, getting it checked out is the first step to feeling better. If you notice a sweet smell on your breath, it could be accompanied by other signs of lung cancer, like a persistent cough, especially if you cough up blood, unexplained shortness of breath or wheezing, lingering chest pain or heaviness when breathing, unexplained weight loss and fatigue, or hoarseness or loss of voice not caused by a cold. Why is that sweet smell important? Early detection is key. It's one of those rare clues that might pop up before the disease gets serious, giving you a much better chance of survival. Lung cancer caught early has a significantly higher survival rate thanks to timely treatment. 2. Metallic smell in breath or sweat. A metallic scent like rusty iron, old copper, or pennies might come from your breath, sweat, or even skin. This could be due to chemical changes in your blood. Blood cancers like leukemia or lymphoma disrupt blood cell production and destruction, causing a chemical imbalance. Cancer cells can also mess with the body's iron and other metal metabolism, leading to a buildup. As cells break down, they release volatile compounds that smell metallic. Why might this smell be overlooked? It's often faint and easily mistaken for body odor. People might blame diet, environment, or hygiene. And frankly, a metallic smell isn't usually the first thing that springs to mind when thinking about serious illness. If you notice this smell, it might come with other symptoms of blood cancer. Extreme fatigue, your body isn't making enough healthy blood cells, persistent fever or recurring infections, a weakened immune system, unexplained bleeding or bruising, low platelets, unexplained weight loss, cancer uses up energy, and swollen lymph nodes, especially in the neck, armpits, or groin. Why is this metallic smell important? It could be an early warning sign. Blood cancers progress quickly, but this smell might appear before other symptoms become obvious. It shows a serious disruption in your body's chemistry. What should you do if you notice this smell? Don't ignore it. If it's persistent or unexplained, see a doctor right away. They might order blood tests to check your blood cell counts and look for abnormalities in white blood cells, red blood cells, and platelets. A bone marrow biopsy might be needed to check for cancer cells, and a lymph node biopsy if you have swollen nodes. Keep an eye on any other symptoms like swelling, fever, or weight loss. 3. Ammonia. Smell in urine. Strong-smelling urine that resembles ammonia or highly concentrated urine could indicate a problem. This pungent odor might be due to reduced kidney function, where cancer can hinder the removal of waste products from the blood, leading to a buildup of compounds like urea. Urea breakdown produces ammonia, causing that distinct smell. Kidney cancer can also disrupt the body's chemical balance, affecting urine composition. Why is this ammonia smell often overlooked? It's easily confused with common issues like dehydration, a high-protein diet, or a urinary tract infection, UTI. Early-stage kidney cancer often lacks obvious symptoms, making the ammonia smell easily dismissed. Many people assume changes in urine odor are normal due to diet or medication. Accompanying symptoms when ammonia is present in urine often include lower back or flank pain, blood in the urine, hematuria, unexplained weight loss, persistent fatigue, and swelling in the ankles and feet. Why is that ammonia smell important? It can be one of the first signs that kidney cancer is affecting kidney function. Early detection significantly improves survival rates through surgery or medical therapies. What to do? Don't ignore unusual smells. If the ammonia smell persists, seek medical attention even without other symptoms. A doctor can perform urine tests checking for blood, protein, or other abnormalities, blood tests assessing kidney function and glomerular filtration rate or eGFR, and imaging tests, ultrasound, CT scan, or MRI to detect tumors or kidney damage. Keep an eye out for accompanying symptoms like hematuria, back pain, or unusual swelling. Confusing factors include dehydration, concentrated urine, UTIs, which can also cause ammonia odor, and high-protein diets. Protein breakdown increases urea and ammonia. The importance of recognizing this. Kidney cancer is often diagnosed late due to a lack of early symptoms. That ammonia smell could be a rare early warning sign. Early detection and treatment are crucial for a better quality of life and improved survival chances. 4. Rotting flesh smell. A foul odor, like rotting flesh, often comes from skin sores or wounds that won't heal. This smell is usually caused by necrosis, cell death, from uncontrolled cancer cell growth, releasing smelly compounds, or secondary infections, making the smell worse and linger. Why is this smell often overlooked? The sores might be hidden on the back, neck, or scalp, making them hard to spot. The smell might be mistaken for a simple infection or poor hygiene. Many people don't associate a strange smell with cancer, especially without other obvious symptoms. What other symptoms might appear? Unusual skin changes like sores that don't heal for weeks or months, moles changing color, size, or shape, often asymmetrical with blurry edges, new bumps or patches, red, itchy, or hard, bleeding or oozing sores, and unusually dark or pale skin. Why is this smell important? It often shows up when skin cancer is advanced and necrotic or infected, meaning the cancer is progressing. Even if it appears late, the smell, along with other symptoms, can still help catch the cancer before it's too far gone. What should you do? See a doctor immediately if you have a sore or unusual skin patch with a foul odor. They might do a skin biopsy to check for cancer cells, blood tests to look for inflammation or other abnormalities, and imaging tests to see if the cancer has spread. If you notice a new sore that won't heal, changes shape, or bleeds constantly, don't wait, get it checked out. What might be confused with this smell? Regular skin infections can have a similar smell. Poor hygiene or the wrong cosmetics can also cause a smell, but it's usually not as persistent. Other conditions like diabetes or bed sores can also cause necrosis and a foul odor. Why is early detection so important? Skin cancer is common, and melanoma is one of the deadliest types. But if caught early, it's highly treatable. Untreated skin cancer can spread to organs, lowering survival chances. 5. Sulfur or rotten egg smell in breath. If your breath smells like rotten eggs or sulfur, and it's coming from your stomach, it could be a sign of digestive issues. This distinctive smell often happens when digestion is disrupted. Sometimes, incomplete digestion, a problem that can arise with stomach cancer, slows food breakdown, allowing bacteria to thrive and produce hydrogen sulfide, H2S, that rotten egg smell. Stomach cancer can also disrupt normal stomach function, leading to a buildup of smelly, volatile chemicals. Low stomach acid, another potential consequence of stomach cancer, can also cause fermentation and sulfurous gas production. Why might this sulfur smell be overlooked? It's easy to mistake it for common digestive problems like acid reflux or ulcers. Early-stage stomach cancer often has subtle symptoms, making unusual smells easy to ignore. Many people also assume the smell is due to diet or poor dental hygiene, delaying a doctor's visit. What other symptoms might accompany a sulfur smell? It's rarely alone. You might also experience upper abdominal pain or discomfort, feeling full after small meals, nausea, or vomiting. Especially if it's bloody or coffee ground-like, unexplained weight loss, blood in your stool, black or tarry, and persistent fatigue. Why is this sulfur smell important? It can be an early warning sign of serious stomach problems even before more severe symptoms appear. Early detection of stomach cancer is crucial to prevent it from spreading and to improve treatment outcomes. What should you do? Don't ignore a persistent sulfur smell unrelated to food or oral hygiene. See a doctor. Tests might include an endoscopy to directly examine your stomach lining, a biopsy to check for cancer cells, blood tests and imaging scans, CT or MRI, to see if the cancer has spread. Keep track of any digestive symptoms and share them with your doctor, what might be confused with stomach cancer. Other digestive issues like ulcers or acid reflux can cause similar breath odors, but they usually aren't as persistent. Foods high in sulfur, onions, garlic, eggs, can also cause a temporary sulfur smell, but without the other warning signs. A Helicobacter pylori infection can also cause a similar smell, but it's treatable with antibiotics. The bottom line: because stomach cancer is often diagnosed late, recognizing a sulfur smell could be key to early detection. Early detection significantly increases your chances of successful treatment and survival. 6. Sweet, unpleasant skin odor. A sweet but unpleasant smell, often coming from the skin around the breast or from sores, lumps, or areas affected by breast cancer, can be a warning sign. This odor is caused by tissue necrosis, tissue death, as cancer cells grow uncontrollably, leading to the breakdown of tissue and the release of smelly compounds. Secondary infections in sores or lumps can also contribute to the smell. Why is this often overlooked? Many mistake it for poor hygiene or a minor infection. The smell often appears late, when tumors are larger or there's an open sore, making early detection less likely. People rarely associate a strange smell with breast cancer, especially without other obvious symptoms. This sweet smell often accompanies other breast cancer symptoms like lumps, often painless initially, skin changes, redness, dimpling, or an orange peel texture, unusual nipple discharge, clear, yellow, or bloody, often with a sweet smell if infected, breast size or shape changes, breast pain or tenderness, possibly spreading to the shoulder or arm, and non-healing sores. Why is this sweet smell important? It's a clear sign of advanced cancer and tissue death, urging immediate action. Ignoring this smell in skin sores can lead to more serious, widespread cancer. What to do? Don't ignore any unusual smell or discharge. See a doctor immediately, even without other symptoms. They may recommend a mammogram to check for lumps, breast ultrasound to detect abnormalities, or a biopsy to test for cancer cells. Keep track of any discharge or sores, noting color, smell, and amount. What might be mistaken for this smell? Minor infections, often with fever or pain, poor hygiene, easily remedied, or allergic reactions to cosmetics. The good news: breast cancer has a high cure rate if caught early. While this sweet smell often appears late, recognizing it alongside other signs can still lead to timely detection and prevent the cancer from spreading to bones, liver, or lungs. 7. Decomposition like fecal odor. Foul-smelling stools, stronger and more persistent than usual, often resembling decay, are a significant change warranting attention. This unusual odor can be linked to several factors, including digestive issues stemming from colorectal cancer. Cancer disrupts digestion, leading to a buildup of chemicals that create an unusual smell. Toxins like ammonia and sulfides accumulate, causing a characteristically foul odor. Internal bleeding from cancer can also alter stool color and smell, sometimes resembling rusty metal or decay. Why might this be overlooked? Changes in diet, high-protein, spicy foods, or sulfur-rich foods like onions, garlic, and eggs can temporarily alter stool odor. Early-stage colorectal cancer often presents with subtle symptoms, making the smell easily dismissed. People may simply assume the unusual smell is temporary and unrelated to a serious condition. Accompanying symptoms often include blood in the stool, bright red or dark, tarry, changes in bowel habits, diarrhea, constipation, incomplete bowel movements, abdominal pain or cramping, unexplained weight loss, and persistent fatigue. Why is this important? A change in stool odor can be an early warning sign of colorectal cancer, increasing the chances of early detection and treatment. Colorectal cancer is often diagnosed late, but noticing unusual stool odor can significantly improve the odds of early intervention. What to do? Don't ignore persistent, unusual stool odor. Seek medical attention, even without other symptoms. Tests may include a stool test for hidden blood, a colonoscopy to directly examine the bowel, and CT or MRI scans to assess the extent of any cancer. If the unusual smell is accompanied by other symptoms like abdominal pain or altered bowel habits, see a doctor immediately. Possible sources of confusion include diet, high-protein fermented foods, fast food can temporarily alter stool odor, gastrointestinal infections like colitis or other infections, and medications. Some antibiotics can temporarily change stool odor. The bottom line: Colorectal cancer is a leading cause of death, but early detection significantly improves the chances of a cure. Paying attention to changes in stool odor could save your life. Early diagnosis prevents complications and allows for more effective treatment, reducing the risk of cancer spreading to other organs. 8. Moldy or rotting wood, breath odor. A musty, woody, or damp smell in your breath, persistent and not improving with better oral hygiene, could be a sign of something serious. This smell happens because decaying tissue from oral or throat cancers releases smelly chemical compounds. Secondary infections in mouth sores or lesions can worsen the smell. Cancer also disrupts the mouth's natural cleaning process, leading to bacterial buildup. Why might this smell be overlooked? It's easily mistaken for common dental problems like gum disease or cavities, or simply poor hygiene. Many people aren't aware that cancer can cause this distinctive odor, and in early stages, the smell might be faint and easily dismissed. Along with that musty smell, other symptoms might appear. Sores that don't heal, white or red patches in your mouth, pain while chewing or swallowing, possibly spreading to your ear or neck, hoarseness or voice loss, lumps or swelling, and unexplained bleeding. This smell is a crucial early warning sign. Early detection means more effective treatment and prevents the cancer from spreading. Don't ignore a persistent, musty smell. See your doctor or dentist immediately. Thorough exams, biopsies, and imaging, like CT or MRI scans, can help diagnose the problem. Pay attention to any accompanying symptoms, what might be confused with cancer. Gum disease, cavities, or mouth infections can cause similar smells, but usually with noticeable pain or inflammation. Poor oral hygiene can also cause bad breath, but the smell usually improves with better cleaning. Smoking and drinking can cause bad breath, but not this specific musty smell, unless there's an underlying issue. The good news is that oral and throat cancers have high cure rates with early detection. That musty smell and those unhealing sores are your body's way of saying, hey, get checked. Early detection saves lives by preventing the cancer from spreading to your lungs, lymph nodes, or other organs. Hey, your body's amazing. It doesn't shout, it whispers. These 8 subtle smells might seem small, but they could be your body's SOS. Early detection is key to fighting cancer, so let's spread the word. Share this info, help others hear what their bodies are saying. Life's precious, and a little action can go a long way. Ready to make a difference today? You got this.